We're live.
Wow.
Here we are. It's happening. Hi, everybody.
Hi.
Welcome. The COVID Convos. It's been a couple of weeks. Bunch of shit has happened. You remember all together, Marsha was taking a freaking break because she needs a break. And we talked about a bunch of random shit that I can barely remember. Superheroes, what we're doing for New Year's. Anyways, it was Marsha, you were very, very missed, but we plotted through anyways, just talking about random stuff. I think we'll just get started tonight and just maybe say hello. It's just me and Levi and Marsha tonight, everyone. So this is like serious throwback to, April. When did we start doing this? March, April? Like we started really early, hey?
Yeah.
Like we got shut down and we were like, uh-oh, we gotta go. Yeah, March, way back in March. All right, so Karen.
No, probably April.
Pardon me?
I would say April.
I would too, actually.
Yeah.
March was when we were still like, oh, the kids get an extra 2 weeks off school and then they'll all go back. Oh my God. Good for us.
You guys are like that.
I know. March was like, no.
Anyway, no, actually, I remember when it started. We have, because there's a group chat with us, a couple of us drag queens, and then so Bannock Waves was the last event that we all did at Club 200, and then like that week things were like, there was like some seriousness around it. I remember there was this group chat and I was like, maybe they'll cancel Pride. That's what I was really excited for. I was like, I was just like a year off of Pride.
Well, you heard it here first. Levi wished it and it came true.
I know, I'm very sorry because now I just wanted like the first week of June and then that was it. But
oh my God. We said the same thing to Georgia. I'm a kid who was like, I just don't want to go to school. I wish, and her New Year's wish, like really do like a wish thing in New Year's. And she was like, I wish I could just be done with school for this year. And then we were like, oh, Georgia, great. Now we're having a pandemic. Anyway, so lucky all of you to have Levi and me and Marsha coming at you live on your various screens. How's everybody doing? How's it going?
I don't remember the conversations that I had this morning. Like, I feel like they happened 3 days ago. They could have happened 4 hours ago. I don't know. So that's where I'm at.
Fair. How about you, Marsha? How are you doing?
I would say I had 1 week of excitement that 2020 was over, that overlapped with a week of 2021 is not showing signs of being a whole lot better, but here we are, and trying to keep some type of positive outlook and self-care. But I think I fell into the trap of thinking the new year would come and something magical would happen and it would not be the same. And things are the same. So that's where I'm at.
Seriously, I want to be the person who's like, what can we do to like hold on to the good? Like, I have gratitude conversation on my list, but I'm like, you have to dig fucking deep right now. It's not easy out there. And it's tricky. So I've definitely got my unicorn rosé for this COVID convo, the gay rosé. It's kind of sweet. I don't know. Didn't you think it was a bit too sweet?
It was a little bit sweet, but I liked it, and the can brought a lot to the game, like in terms of the enjoyment level. But I had one thing to say around gratitude, which is, the year ended off tough for our family in a lot of ways, and was just reflecting a lot about how oftentimes it's positioned like if you're feeling frustrated or grief or anger or sadness, that can't coexist with gratitude, and actually how that's not true. That we can be grateful for things and still be grieving or angry or sad. They don't have to cancel each other out. I think being grateful is important, but it doesn't have to take away from the experience of the other feelings with all the stuff people are going through too.
Totally. Like, I love a paradox, and 2020 has been one. And so I feel like it's like I've been like practicing sitting in feelings that feel crappy to me a lot, like many of us. And also thinking about like those tiny little moments that just like are enough to get you through. Like even just watching your Instagram, Marcia, your dad building you guys like a freaking Olympic hockey style skating rink.
Yes.
Like the best. And I
It's
love
not even close to Olympic size, but as of today,
I know
there are 2 spotlights.
Oh my God. I love it. I feel like it's really good. I cannot wait for the moments when you can have people outside in your backyard. Anyway, all right. Should we just kind of jump right into it? As always, anyone who's watching, if you have questions or comments or like really have anything to say in particular, if you're like, if you're just like, if Marcia's saying something or Levi or I, and you're like, oh, I have another question on top of that, pop it in the comments. It like, Jude does a thing where it ends up scrolling along the bottom so we see it a lot better. And I think we'll just kind of get rolling, just talk a little bit about COVID and then talk a little bit about like what the hell is happening out there in our like freaking apocalypse lifestyle. Marcia, do you want to kick it off?
Wait,
I do.
why did Dave say God damn it?
Okay.
And then also your earrings are getting a lot of love.
I know, listen, because these are my fuck you earrings, because it's been that kind of Tuesday, everybody. And so talking about coexisting joy plus rage, this is my gratitude moment. I literally was like, I'm going on COVID Convos. I can put on a big freaking earring. And then I remembered that I had these and I was like, yep, the people need these. Anyways, all right, shall we roll?
Yeah. Yeah, and I'll just say now I'm having a bit of regret because I did not go and put my earrings on.
But Marcia, go do it.
So many
go
good
put
ones.
those earrings on. We can hang tight.
I feel like that would interrupt the flow, but if there's a natural pause
Is
in which
there a
someone
flow?
is maybe doing a monologue, I will slip and grab some earrings.
Is there a
I'm
flow?
going to do it.
Yeah, there's
Okay,
a
because
flow.
that will bring me some joy. But
Yeah.
in the meantime, let me just do a bit of an update on where things are at with COVID in the province. And today they announced 92 new cases, which is the first time we've been under 100 new cases in several months. So that's nice. I think, you know, one of the interesting things is certainly some people followed guidance and were really careful over the holiday season. Some people less so, that hit the news. And while we saw a bit of an upswing in cases, we've also seen some lower numbers. So I think still waiting to see how that is shaking out, but on the right track, I would say overall. Okay. So hospitalizations, I have to say, I'm looking at the data now and it is getting confusing how the province is reporting it. So there are 302 total hospitalizations related to COVID and 138 active hospitalizations. It's a bit tricky to understand those numbers, but the 138 would be patients who are considered infectious. All right. But because COVID can cause quite long illness, quite long respiratory failure, people needing to be having extra supports in hospital for a long time, that's why those numbers are so different. And then kind of same thing with the ICU. 35 people in total in the ICU related to COVID, but 21 who are considered active, which would be people considered in that infectious period, generally the first 10 days or so. The test positivity rate is hovering around 10%, and today was 10.1%. One thing I would note is that, so what's today? Today's Tuesday. Testing volumes have generally been quite low. And so again, yesterday, tests were under 1,400 in the province. So would like to see some more people going out for tests. And so just a reminder to folks, anyone who has symptoms that could be from COVID, you can check those out on the shared health screening tool. But in general, things like new fever, sore throat, cough, shortness of breath, loss of taste or smell can cause stomach symptoms like vomiting or diarrhea, runny nose, headaches, a big one. New symptoms like that, particularly if they last more than 24 hours, to go and get tested. And of course, anyone who's been told by public health that they should get tested because they've been exposed as a close contact. So maybe I will pause there and see if there's any comments from you guys or any questions.
Levi, you got anything?
No, no, it's
I
pretty.
went, yeah, it is straightforward. I wonder about people not getting tested. Like, I feel like people are like, do you think it's part of people just being tired, Marcia, or do you think it's like people like what do you think's going on? I know you're not. I know that this is not like a thing you like to do, which is guess at things, but like it's interesting to me that given the rates that we have and our test positivity number, like all of that, that we don't have more folks who are like just showing up with the sniffles. You know how we were testing in like September, October, November? Like I got tested twice, very much thinking that I did not have COVID, but just because I had a symptom or two, you know?
Mhm.
I don't know. What do you think?
I do think that's part of it. I would say in First Nations communities, we've started to see an upswing in testing again. Definitely went down over the holidays,
Yeah.
both in the province and in general, and First Nations as well specifically. So I think a lot of that had to do with people not wanting to get tested, not wanting to be told to isolate, not wanting to interact with the system,
Yeah.
wanting to feel somewhat normal and celebratory. So I think
Yeah.
lots of different factors relating to that. Hopefully, we'll start to see more people getting tested. Positivity rate, so that percentage of tests that come back positive, is still quite high, right? So 10% seems lower when we've been up around 20%, but it's still high when we're thinking about an infectious disease spreading in the community, right? And I would remind people about going way back when Brent was talking about how anything over 3% would be evidence of community transmission, right? And for quite a long time, we were under 3%. We're always watching for that landmark of when it would be more evidence of widespread community transmission. So 10% still high, right? So
Too
cases
high,
are coming
everyone.
down, hospitalizations coming down, positivity staying high. And again, it just reminds us that even as we will start to see things being lifted in terms of restrictions, so those orders have been extended to the 22nd, we will almost certainly see some changes at that time, that we still need to be cautious. Like, we're not out of the woods here. There's still a lot of this virus circulating in the province.
I feel so like, and whatever, I know there's a whole bunch of like moving parts, but I feel really glad that we extended our orders. Like, it does not seem to me like there is enough space in our healthcare system and with our positivity rates and our numbers. Like, I remember being like freaked out by 30 new cases of COVID back in September, you know? So and I think it's that thing too where like we start to get comfortable with whatever is happening to us, and which doesn't always doesn't equate to like actually it being okay to open or okay to like, see people or whatever. Like, but I also am like, I also would really like to be able to have people into my backyard / go to your backyard.
Mm-hmm. Yeah, and we'd love to have you. And I think, though, I've been thinking a lot about how January, February are often really low times. I don't even know why Levi is chuckling, but
Because you're like,
like
yeah,
often
we'd
really
love
low
to have
times
you.
for people. And then kind of, sorry, did that sound insincere?
It was good. I know. We're good. It is Tuesday fucking night.
That's like an
2020.
introvert trying to pretend like she loves people or wants to be around people.
That's great. Your tone is your tone, and we're here for it.
Okay, but for real, I'm gonna try to like get back on track here with this thought. So the unintended impacts, right, of the excess, I wouldn't say excessive, of the extreme restrictions really start to build up the longer that it goes on. And that can be from isolation, and from not having connections. I know we have all felt it. I would say I have learned more through this pandemic about how important community is for the type of work that I do, when the only spaces that I'm in on a regular basis are spaces that are really challenging, that do have a lot of anti-Indigenous racism and a lot of colonialism. Um, then I really miss spaces that are safe. And virtual spaces are great, but let's be real, it's not the same as being in person, connecting in that way. So I certainly feel it, and I empathize with others who are feeling that as well. But then also prolonged periods of income insecurity and food insecurity and house insecurity and family stress. Like this is just layering on and on and on. So there are a lot of positive well-being reasons as well to try to loosen the restrictions so that we're finding that sweet spot where there is enough regulation in place so that we're not having kind of uncontrolled community transmission at levels that our healthcare system cannot respond to. And certainly we have neighboring jurisdictions that are experiencing that right now, but where also we are not so restricted for such a long period of times that these unintended impacts, whether they're mental health, other health problems, overdose, are getting, you know, or have been and continue to be really unbearably high. So I look forward to lessening the restrictions to a point where we can be mitigating some of those impacts.
Totally. It is like a weird, yeah, it's just hard, man. This is like pandemic life, you guys. It's really tricky. And like, I feel like I've learned a lot of things about myself too, and about like connecting with people. And I'm like happy to stop learning for a while. Like I'm good. Like I just need to like integrate. So I'm really excited about
Yes.
What else. Like
a plateau is so awesome.
So I, like, you know, I don't know. I wonder about like, there's just things, you know, and like the connection piece is really big. So like, if, like you, Marsha, I have an old dog that is like getting sicker and sicker. And like on the weekend, Jess was like, you know, she like popped a cyst and we'll see and da da da. And I was like beside myself, like just, I was like, I cannot, like more loss in this moment just feels like a lot. And I feel like a lot of people are, because of the nature of this pandemic, people are experiencing tons and tons of loss. Our grief is just sort of like out there waving around, and being able to like see people that that love us or that we love, like, and show up for us in ways is like really important while all of this stuff is going on. And I just think about all of that. And then I also think about how I really want any loosening of restrictions to be about connection. And I know there's like a survey or something. Have you looked at that survey on the internet, Marsh? Like, should we all be going on that survey and telling the people what we think to start with? Or is like, what do you think about it?
Did the province put out the survey
Yeah, like,
on what the public?
I don't know. I don't know if they did or not.
Is that what you're talking about?
Yeah, I just heard that they were going. I have no idea if they did or not because, God help me, I can't stay on top of anything right now. But I knew they were going to, and I like logged it in my brain to be like, I should probably think about doing that later, because I don't know. I just think sometimes like opening things that are not creating connection over opening connection up for people is something that, I don't know, it's important to think about. I don't know.
Well, and I think, you know, really reflecting on what we've learned so far through this pandemic and who bears the risks of reopening and how we can strengthen protections in those populations. Like, we have been doing this long enough that we have learned some things. And so I have also heard that the government is going to put out a survey on public opinion around the reopening. And so that's the type of thing I hope people would reflect, kind of what would make me feel more connected, what would make me feel more well, and how to prioritize amongst those things, but also what protections need to be in place for people, whether we're talking about the service industry or healthcare workers or transportation, all those different aspects.
Totally. I think about it all the time where it's like we are like, you're opening up to be able to go and do stuff, but it is at the expense of people who have little choice in whether or not they're able to show up to work or not. And I think that is like, and among a million other freaking issues, but like I think about that as well. Like, how do we actually like create opportunities where I can maybe like go for a walk with my parents and then have, you know, a 2-meter distant tea inside my house and then send them on their way, which is different from like, you know, like asking people to serve me at a restaurant or asking folks to drive me somewhere, you know, like that kind of, I don't know. I'm thinking about all that. Alrighty. Levi, did you want to hop in on anything? You're like, hard pass. Is this just going to be like Marsha saying stuff and then me being like, yeah, and this, and then Marsha being like, well, let's temper that a little bit.
I'm using the same strategy that I use in university. Is like when I feel like the professor's going to come ask me a question, I just take a drink of my water or my coffee, and then like
I know, but I'm good. Well, I'm not actually good with silence, but I can make an exception for you and be like, we'll just wait for Levi to finish drinking. All right. So do we need to, let's talk about, I wonder if we need
I'm
to
like
have like,
very good with silence.
I know you are. So both of you guys are. Yeah, that's as good. I'm done. That was cute for a minute, for like a second. Anyway,
like, that was like not even 2
yeah,
seconds.
a second. You guys, I'm doing my best. Okay, we all have different strengths. Jesus.
Yeah. Okay.
All right. Let's talk about vaccines. Let's talk about variants. Let's do this. That was a long time, okay? That was a long time. Ugh. All right.
I was just like, you took a sip, then Levi took a sip. I was wondering if I should then take a sip to make
A fake. That's right.
Keep it going.
Well, that's what we'll do. Just
So
10 minutes.
vaccines or variants? Which one do we want to?
I don't know. Like, maybe we should start by talking about vaccines before we go off into
I think this is an opportune time for. Okay.
What?
Like, she was gonna go put on her earrings to force me to.
We were going to talk about. I was going to go put on my earring.
Do it.
Okay.
Go do it.
Drinking in silence. Okay.
Yeah, I am not gonna talk about drinking in silence because I'm just gonna drink and speak. I don't recommend this 14 Hand Unicorn Rosé Bubbles for its flavor, but I do recommend it for its can. I was completely sold.
I love buying liquor because of the packaging, for real.
I know.
For real.
There's some good packaging out there.
Also, what's behind you? What is the thing? So there's the art, and then
okay,
you know what that looks like to me? It looks like when I was an office administrator many times in my life, it looks like an old mail slot.
It kind of the shelves up there, they're old print shelves, like you would put like for like screen printers, you put like letters in each of the shelves, like they so Jess had them kicking around the basement, and I don't know about you, but I like my child, enjoy collecting shiny garbage. And so I would have like I had lots of little doodads all over. And Jess really was like, is more about containing the things. And so was like, why don't you put all of your little tiny things in the shelves? And so now I have a whole bunch of very teeny tiny little objects that I love that I put in there. So that's what's behind you. I wonder if I should pull a couple out because there's some cute shit in here. Like, isn't this tiny little porcelain cat that my granny used to have? Hello. Like weird shit like that nobody really wants all over the place.
Is the cat wearing a hat or is the cat wearing one of them cones?
She's wearing a freaking thing on. She's wearing a bonnet. Look, it's tied at the back.
Okay. Oh, there's the ribbon and stuff. Okay.
Like this kind of weird shit. So listen, if I ever can have company over, you can all come over and look at my weird collection of tiny things. It's pretty awesome, and that's what's behind me.
I'm gonna shut my camera off now because I'm not wearing giant earrings.
Oh my god, look at those freaking! Oh yeah, those do look good, Martha. Score.
I think I found some earrings in my couch. I'm gonna get them.
Yeah, pull them out.
Thank you. You should put on the prairie sky earrings that I got you.
They are locked away in my room. So I'm not getting up because I had to rejig the whole situation that I'm in. So I'm just gonna wear these earrings that I found on the floor. There's also the earrings were also they were in a bag of nails. A whole box of nails from when I used to do drag.
Oh my god, I love this. Like Karen, I'm like, pause now for femme station identification. We just needed to take that minute, and I feel like we're all better for it. I love that, Marsha. You were like, earrings on, scarf off. Let's do this thing.
Feather, can you give me some nail glue?
All living the earring dream. So good.
I also just want to share that when Levi said his earrings were in a box of nails, I was imagining like nails that you hammer things, not like nails you put on. So,
this one you
me.
could hammer into something.
Ooh, that's a nice one.
Yes, you could.
Yeah. Okay. Anyway,
okay. Can we talk about vaccines now?
Vaccines variants.
I mean, if we have to.
Yeah. Yeah.
Tell us about it, Martha.
So,
Where are we at?
what do you think the key questions about vaccines are? Like, is it what's going on in the province with vaccines? Is it what are the vaccines?
Yeah, I think
actually I have a question because we did buy about 40 million, like Canada, as we filled 40 million doses of the Pfizer vaccine. So the big question that we always hear is like, so when we hear about vaccines, people want to know when's it going to be normal. And so I was wondering if you could maybe explain to me, like, what are the difficulties in trying to find a timeline from a public health perspective about what normal might look like.
I think so too. Like, I think it would be good to kind of understand how vaccines are like a component or like a tool in our toolkit, but don't actually mean a difference in.
Okay.
Yeah, let's start there. I have a few questions after that too.
Okay. So when we think about how do we get back to more normal functioning of society, which is how I've interpreted that question, is yes, no, yeah. Okay. Then what we are thinking about is when is enough of the population immune that as this virus is circulating, we don't have to do disaster planning for the number of people who are going to end up in hospital or in the ICU or having severe outcomes, right? Like that's essentially what we're trying to get to. We accept coronaviruses have circulated for a long time. This is essentially a coronavirus variant, probably going to be here for a long time. So how do we get enough of the population immune to it that it doesn't disrupt our society to the levels that it currently is? And there are really two ways to do that. We get immune to the SARS-CoV-2, which is the technical name for the virus that causes COVID-2. So type of coronavirus variant. We get immune to it either because we've been infected by it or we get vaccinated. And, you know, in general, what people are saying and what's been shown previously is if 70% of your population roughly is immune, that's when we won't see this worst case pandemic type scenario response, right? And people probably will have seen that we don't expect in Manitoba to have enough of the vaccine to vaccinate everybody this year. Like that will be into 2022, which means that throughout 2021, we're continuing to deal with this. Hopefully not at the level of restrictions we're seeing currently, but you know, we've talked in the past about that idea of dynamic restrictions, so tighter when they need to be, looser when they can be. We saw that, you know, in the summer heading into fall, and then certainly the big change again, October, November, December. And so the vaccine's a really critical tool, but it's not going to be replacing for a very long time the need to practice the other measures. So the physical distancing, hand hygiene, masking, occupancy limits, things like that that reduce our contact to each other, especially because as we're starting to pull back on these restrictions, we're not talking about a May, June scenario where there was very low case numbers and very low test positivity. We're talking about accepting a higher level of case numbers, higher test positivity, and trying to plateau at a higher level where we know the virus is circulating, that there's ongoing community transmission, but we're just trying to control how much of that is going on. The vaccine, the way it's being targeted right now is to try to reduce the burden on the healthcare system and to protect the functioning of the healthcare system, right? So that's why we see healthcare workers being prioritized in graduated ways to protect the functioning of the healthcare system. And then, yes, personal care home residents, and I could talk a bit about what's going on in First Nations communities because of those disproportionate impacts to try to reduce morbidity and mortality in our communities, but also, again, to reduce pressure on the healthcare system So, for example, my mom is waiting for hip replacement surgery. Those have all been canceled. All the other type of healthcare, or a lot of types of healthcare that we need that's considered elective, has been canceled. That also is an important element of getting back to normal functioning. So the vaccine is an additional tool to public health measures that do include restrictions, and that includes the other things we've talked about over and over again to try to mitigate those impacts from COVID-19.
Does that answer your question, Levi?
Yeah, no, that does make sense. It doesn't really address the timeline part. So like, but it does in a kind of a roundabout way. Like so but it's also so hard to predict, and so it's like when you're trying to relay information, accurate information in kind of the environments that we work in, it becomes a little tricky and muddy. But you just have to kind of that's just. But people are used to that right now. They're used to the tricky and the muddy.
Yeah.
Yeah.
It's just the general frustrations around that we're all feeling, but they're
like in terms of timeline. Oh, sorry, I have a bit of a delay, so it's hard for me to not interrupt. But I was just saying, in terms of timeline, we are months and months away from the number of people being vaccinated being able to impact the other public health measures. Like best case scenario, what are we looking at? Summer, fall, next like 2022, before the number of people who have been vaccinated is significant enough to offer any kind of societal protection. It would be offering individual protection to those who have been vaccinated way before that. And that will help for things like healthcare system pressure and healthcare system functioning. But in terms of like society getting back to normal, we are far away from having a high enough percentage of people vaccinated to be able to change our public health measures based on that.
Do you ever imagine a scenario, and like I know it's another moment, Marsha's moment of speculation. I wish I get a flashing thing. But like, do you ever imagine like a moment where we're gonna be like some of our neighbors to the south, where they're rushing out the vaccine for older populations so that they'll just lift all restrictions? Like I was reading about how in North Dakota, that's kind of been the plan, is like they're going to roll out all these vaccines for older folks and those people at higher risk. And then they haven't really had any kind of restrictions anyways, but they're just like, well, we've already dealt with the brunt of it. So now we're just like kind of, I don't know, folding to public pressure in a sense. Do you get the sense that maybe that might be something that might happen here? Or do you think that we're just gonna, do you think that Manitobans in general, like this could be both of you, do you think that Manitobans in general are just like, we have a desire to stay the course for the long term, even if it means that there's going to be some form of restrictions, or not restrictions, but some form of kind of measures in place all the time? Does that make sense?
Yeah, totally. And I think, one of the things I would say in response to that, though, is, for example, the publicly available data we have shows that for First Nations people, the median age of hospitalization is 50, which means half of those hospitalizations are under 50. So for us to be getting to the point where enough of the population is vaccinated that we're reducing those severe outcomes, we're talking about much younger than people are imagining when they're saying let's roll out to the elderly population, because we're actually talking about people our age, quite frankly, if we want to reduce hospitalizations by more than half, right? And I think if we looked at data in other jurisdictions where there's more publicly available information, we would see that median ages for severe outcomes, including hospitalizations, are much younger. And I think that's part of the danger of kind of colorblind data with no income analysis, like no intersectional analysis, is people are imagining these elderly white people in the hospital, and that's not what the data shows where the data is available. that it's actually younger people from lower income quintiles, it's younger First Nations people, it's younger people from some specific BIPOC communities that are being impacted at disproportionately younger ages, and that those are also the people who are more likely to be in higher risk occupations, whether that's manufacturing or food processing or the service industry, things that we talk about opening up more of, right? And so normal functioning of society also requires ensuring that these populations who are a really integral part of the workforce, who are valuable members of society and families, and who are not elderly and white, also have access to the vaccine. So I think that's part of the way I would think about that.
And then Marcia, when we're making decisions about like and by we I mean you and all the other people who are actually making decisions, like when you're doing that, are we thinking about, like I've definitely talked to people who are like, what's the order gonna be? Like what is the, like how are we gonna decide, like as we have more vaccine come in, what next? You know, like are we gonna see things like, you know, if you work in the service industry, if you're a grocery store worker, like before we get to the like gen pop moment, like general population kind of moment, where I remember with like H1N1, it was a while before we did general population, but because this pandemic is so different, even from that, like thinking about like is that a consideration? Like thinking about, you know, who is being like sort of like not forced, but like who has to who kind of forced, like who has to show up to work, and are those folks gonna, like, to me that seems like a natural next step to be like people who are asking to work through this, who are deemed essential, and as our codes change, that increases people, those are the folks that we'd be like, do you want to like you go next or whatever. I don't know, like is that the kind of conversation that happens when we're deciding how a vaccine rolls out?
Yeah, so I'm really only part of the conversation specific to First Nations people, and you know, with all want to give some credit where credit is due. Those conversations are going well with the provincial task force overall. I would say the CDC, so the American Communicable Disease Control or whatever that stands for, has published some work as well around this that talks more about essential work groups than probably the NACI recommendations do. But those are all considerations that are on the table and that are being made. I think it's really important that we look at what the evidence shows, but also acknowledge where the evidence in Manitoba may not be available, and looking at other jurisdictions and whether their evidence would be expected to apply here as well. But those are the kind of conversations that are occurring.
Yeah, that's good. I just feel like that's the kind of like reassuring content that people want to hear in the world, you know, like understanding how the folks who are making choices are, like what kinds of things they're considering helps people kind of like figure out why things are happening or why they're not happening for somebody in their life that they think it should be happening for, etc. So like that, I don't know, I feel like that's helpful. Levi, I feel like you had a question and I jumped in on you.
No, I was just going to thank Marcia for explaining that, because that was really, really helpful, and it gave me a lot. Like, it gives me a lot to think about. Again, because that's not a conversation I would ever be privy to, and it's also just hard to kind of sort through. It's hard to even, oftentimes when I'm going to answer, when I have a question in my head and I'm sitting at my desk or I'm sitting in bed or I'm like laying on the couch, it's often hard to even just know where to even start looking, because there's so much information, but also the information is so hard to parse through. And we all know that I'm not very good at reading things.
All right. Are there any other questions from folks who are still listening about any of this stuff that we've been chatting about? Feel free to pop it in the comments. I wonder if we should pause vaccination for a second and talk about all of these variants that are coming, like all of this news about like coronavirus variants. Levi and I were like, when is the coronavirus going to get the gay gene? Like, when is that going to happen? Because, you know, just wondering, a homosexual variant. Who's to say, Marsha? Anything could happen. Anyways, can you tell us a little bit about what this variant is?
Anything could happen.
Can you tell us about this variant business? A little bit about like what we're thinking about like vaccination for control, and whether we should all just like collectively just take a breath, or what the story is, if you know anything.
Yeah, I would say it's definitely, yeah, I know a few things. I certainly don't know everything. Uh, but the variants are certainly something to pay attention to. The one that's been most talked about is the UK variant. And of course, over the holiday season is when some news broke around that, made headlines because it appears to be more infectious, i.e., spreads more easily from person to person than what we've been dealing with so far. And the concern that gave me was, okay, well, we're already seeing very efficient transmission in overcrowded housing. Like, what is what is that going to do there? So that variants are being identified is not at all unexpected, is one thing that I would reinforce. Again, it's like in some ways the flu virus, which does change every single year. There are new mutations that come that are different enough that the flu vaccine formulation has to change every year. And so that's why it's an annual campaign. So this isn't new in the field of, virology and infectious diseases that viruses mutate. So the first thing I would say is that it is expected. Not enough experience yet to really know how it's going to change the course of the pandemic in any specific jurisdiction. The UK variant is not looking like it's more severe, even though it looks like it spreads more easily. So that is reassuring. And then the other study that came out this week is showing that the Pfizer vaccine, at least, and the Moderna vaccine is expected to be equally effective. So there is the variant basically means that the virus has changed. And why that matters is your immune system going to recognize that virus or not? Or is it a completely new infection to your body? And because as we talked about before, we're talking about immunity being built up by either previous infection or getting the vaccination. That's what people get excited about. Is this new variant similar enough that our bodies are going to recognize it because we've been infected or because we've been vaccinated? Or is it different enough that we're dealing with a whole new ball game and this is going to go on longer and longer? And the good news about the variant is it appears like both previous immunity and the vaccine are gonna make our immune systems able to respond to this new UK variant as well. So the detection of the UK variant has led to some new requirements. So people who enter Canada on planes now need to be tested. It's led to the push for people before they get on planes to Canada having to have a negative test result. So trying to keep it out. And then also when people test positive at the labs, a certain percentage of those samples will go through genotyping so that we are seeing when these variants are present in Manitoba.
My gosh, that is very helpful. I feel like as soon like variant, just like even just the word variant, I feel like is like very sci-fi-ish, and like I feel like it's enough to just like send us like, okay, it's enough to send me off. So I think like kind of like what I appreciate about us being able to like shoot the shit every couple of weeks is actually just to be because I'm able to. So I don't know how many other people are like, I'm barely checking the news at this point because it's tricky, like the COVID news, I mean. And so thinking about all of this stuff and knowing that we have a chance to kind of like talk through it really freaking helps like a little bit of, a sober second thought or whatever, or like really just like taking a big breath before we move forward. And I think thinking about, I think about like, just like queer community wanting to like all like the fact that like I just feel like I only see like the only people I see in person are my brother, thank God for queer siblings, and then work people who are almost like I see straight people, you guys, like it's just a lot of fucking straight people, and like bless your heart straight people who are watching, but like it is like the desire to connect is so strong, and I feel like that is, especially for those of us who have like complicated relationships with families, going through the holiday season, thinking about how do we actually figure out connection in a way that makes sense. And like, it's complicated. So understanding a little bit about how variants work, and also thinking about how those variants are more infectious, and how important it is for us to be thinking about, like, even just as queer people, is about testing when we have symptoms, things like that. I feel like it's really helpful. I will say, you guys, that I did go to, so you know, the minor injury and urgent care clinic on Corden, Marsha, that you're always like, that's a good walk-in clinic. Yeah. It is it helps it's an excellent walk-in clinic. I'll tell you all that. And they let you book online. Anyway, they also opened a COVID testing site. I don't know if you know this or not, but they borrowed space at Red River College, and it was the easiest testing site ever. It was like one of those drive-through cars. You know, you put all your information in ahead of time, so they just make you look at the label on the testing, on their sample, whatever it is, their sample tube. And then they just shove the thing up your nose while you're sitting in your driver's seat, and then you drive on out. And you can book, ahead. It was a really good testing experience. I will say this for free. So I don't know, just letting people know that was a good spot. And it's not comfortable to get a COVID test. I don't know if you've had one. Hey, Marsha?
Had two.
Two, yeah. And Levi, have you been tested yet for COVID? 3 for Marsha.
Yeah.
Yeah, so we've all been tested. So I feel like it is, it's not fun. It doesn't feel great, but it's actually there's some stuff out there where people are like, this is the worst thing that's ever happened. And I'm like, listen, it's not it's crappy, but it's not crappy. I pushed a baby out of my vagina. It was definitely easier than that. It's easier than a panic attack. There's many things it's easier than. It's easier than being constipated. It's easier than many, many things. Yeah.
Well, that's
Agreed.
it's not even the most uncomfortable infectious disease test I've ever had to get. I still remember the old cotton swab up the pee hole test. So
yeah, and queers, if we are all doing a good job of our STBBI sexual health care, then this swab up the nose is a fucking cakewalk, okay? So we have no excuses if we're thinking that we're on it for our STBBI testing, and we've lived important lives of having random STIs because we're getting laid, then it is important to know that the COVID test is uncomfortable, but it's pretty freaking easy. So yeah, I appreciate that feedback, Levi.
There's no speculum.
Yeah, seriously. No one's cranking open your vagina, y'all, or shoving cotton into your penis. So, you know, it's just a crappy moment.
It wasn't even it's not even it wasn't a nice cotton. It was that really abrasive, terrible.
It's hard.
It's very hard cotton.
I mean, it's don't you think it hurts?
It's basically a wood stick.
But you guys, it hurts worse if you have an STI. It's not if you have gonorrhea, the cotton swab isn't going to feel like a sweet, cushiony moment in time. It's going to hurt because you have open wound business, don't you think? I don't know. It is kind of hard cotton. I mean, let us know in the comments if you've been tested for gonorrhea or chlamydia and you have not had it. How is that compared to when you have had gonorrhea or chlamydia? These are just questions and answers that we need to know for the sake of for research and also for COVID prevention. So do what you need to do in the comments. All right. Oh my gosh, we're at 7:51, you guys. What else is going on for folks? Should we chat about what else is on top?
Oh, okay. Totally not COVID related.
Yeah.
But my favorite thing in the world right now is watching those terrorists get labeled as terrorists and put on no-fly lists. I love those videos from those people in the airport. They're crying when they're getting kicked off. Right. But the other thing that really concerns me in those videos is that sometimes people will cheer, but not a lot of people are cheering. And I'm just that's really, really indicative of how many complacent people we have who actually support these types of ideologies. It's really gross. It's scary. But still, I enjoy that moment where they get kicked off and cry.
You know what? Add that to your gratitude list, Levi.
Huh?
Add that to your gratitude list.
I don't have what's a gratitude list? I don't have one. I wasn't listening at that point.
Oh my God, you do have one. You just don't call it that. Where you talk about the things that like stuff that's happened that like makes you feel a lightness. You for sure have it. You just don't call it the thing that my like Cancer water sign calls it because you're a Scorpio. You just do like, but you have it because you talk about it all the time. You talk about the moments at work that connect you to the world and the moments with your like giant aquarium apartment that connects you. That's what I mean. That's what I mean. So you can add people not being allowed to getting on a no-fly list to that list because yes.
I think if I had a superpower, I want my superpower to be, again, to be able to control the no-fly list.
Marsha, last time we talked about what people's superhero power were going to be was like what people, if they could have a superpower, what would it be? And so this is a continuation of that conversation, which is excellent. Control the no-fly list.
We had this conversation yesterday on the way home from work. So you weren't allowed a superpower, but you were allowed like a mediocre power. And Feather had a really good one. It was so funny. I can't remember what it was. It was hilarious. But now I want my mediocre power to be controlling the no-fly list and not smelling parts.
Oh my gosh, bless your freaking queer heart. Somebody like Rowan was like, will confirm test when you have an STBBI is 1000% worse than the COVID test. Take it from someone who got super gonorrhea last year before it was popular. So there you go. Super gonorrhea, bless that super gonorrhea.
So we got two things. So now we have to have a super gonorrhea moment every show. And then we have to have Marsha's moment of speculation with a big like stars and jazz things.
It's true. I did notice that Jude actually put moment of speculation running across there it is.
Could we include the word magical in there? Like Marsha's magical moment of speculation?
Yes. Marvelously magical moment of speculation. Yes, we sure can.
Who doesn't love some alliteration?
I mean, I sure do. All right. Anybody else? Anything else that we want to add before we sign off to folks? Oh, there it is. Marvelously magical moment.
Yes.
It needs to be like Marsha's marvelously magical moment of speculation because everyone knows that Levi and I are speculating 100% of the time.
I like so there's facts and there's reality, and then I live in the speculation zone.
Yeah, it's the beautiful zone. It's important to have people living in this zone because we are very creative and come up with like really innovative things that get stolen by public health. I'll never forget. 2020 was the year that public health stole romance glass from Levi and Sunshine House in general. All right.
I don't know why we invested all that time and energy into calendars when we should have been making romance glass.
Honestly.
We could have done both.
Because those calendars look amazing. Yeah.
They really are
amazing. Like, again, we got to get away from the binaries of either or. This can be both. And I just want to say, Jude is currently my favorite human being for making that happen and adding the, like, not the actual glitter, but the comment that you would add glitter if you could. I just really appreciate that.
Perfect.
Bless that human being. All right. Shall we sign off for tonight, everybody? And
I drank that whole water bottle of the Wonder Woman water bottle. I really got to pee.
Oh yeah, it's time for everyone to go to the bathroom.
I also wanted to so there was one of the pluses about having to move to the couch was I never got to use my pillow. So anytime that you could say something stupid, I could just hold up my pillow. Oh my God, Becky.
Oh my God. You know what 2021 has brought all of you? Fucking props to COVID Convos, you lucky motherfuckers. That is where we're going to leave it off.
Earring moments, earring time. So we have to take one moment every, like one brief second pause, and then we have to accessorize props and Marsha's marvelous moment of speculation.
All right. We're going to leave it there for now, everybody.
And I will not make the mistake. Yeah.
What were you saying, Marsha? You're like, bye. All right,
I was
everybody.
just going to say I will not make the mistake of showing up without earrings again.
Don't do
Also
it.
buy.
I kind of am super comfortable with us being like, hang on, everybody, we got to go like add a little something to like build off of what's happening here. I suppose. Anyways, all right, everyone. And hopefully you enjoyed our earrings. Hopefully you enjoyed the shit we had to say, and we'll see you in a couple of weeks. And hopefully everyone stays well, stays safe, and enjoy your easy peasy COVID tests if you need them. All right.
Buy a calendar.
Oh yeah, and buy a freaking calendar. Sunshine House's calendars. They're the bomb. They're smoking hot. I bought 4. Do I know what I'm going to do with 4? Probably put them in 4 different rooms in my house. So like, you know, we all have things to do here. All right. Good night, everybody.
Bye.
Bye.